குட்டிமா தமிழ் டிவி நேயர்களுக்கு வணக்கம்.
Madhavan, President, Group Oncology and International, Apollo Hospital Enterprises Limited. Mr. Karan Puri, Chief Executive Officer, Apollo Proton Cancer Center. Consultant Anesthesiologist, Dr. Divya, and members from the Apollo family. Now, to officially welcome all of you, I would like to invite Dr. Praveen to deliver the welcome address.
Today we are gathered here not only to celebrate a milestone in breast cancer care, but also to reaffirm our commitment to advancing healthcare in India and beyond. Breast cancer is a persistent health challenge in India, where 1 out of every 4 women is diagnosed with breast cancer. Tragically, more than 50% of these cases are diagnosed at an advanced stages, making survival more difficult. While survival rates in India stand at 60% compared to 80% in the United States, these statistics remind us that early detection and innovative treatment options are critical in improving outcomes. At Apollo Proton Cancer Center, we are proud to announce India's first successful endoscopic mastectomy with reconstruction, a novel procedure that combines minimal invasive techniques with state-of-the-art technology. This innovation allows us to treat breast cancer while preserving the patient's physical appearance and minimizing recovery time, and addressing the emotional and psychological needs of the patient. Our dedicated team of experts, led by Dr. Manjula Rao, has redefined what is possible in cancer care by combining technology, expertise, and a compassionate, patient-centric approach. With every step, we strive to set new benchmarks and pave way for future advancement in oncology. Thank you for being here today and for supporting our mission to transform cancer care.
To share her insights on India's first endoscopic mastectomy with reconstruction.
Good morning to all of you. Thank you so much for taking the time out to listen to us and share with us our happiness and pride in this achievement of ours. And I'll tell you why I say ours in a moment. So it gives me great pride here today to stand in front of all of you and talk about the first endoscopic mastectomy that's been done in the country. And it's fantastic, and we feel really happy that we're able to bring in this innovative technique which is centered on a patient-centric approach to all of you. And this is not just a personal achievement. This is an achievement for the organization Apollo, and also an achievement for the country, where we believe in making everything available for our citizens, ensure that we make available to the patients we treat. So gone are the days when we use such grotesque methods of chopping off the breast or burning the breast for somebody who's been affected with cancer. Today, the highlight is on conservation of the breast. It is on conservation. It is on saving the organ rather than removing it. But in breast cancer care, we have gone a step forward. We believe in not just saving the organ, but ensuring that it looks exactly the way it was before we had operated. And that is made evident by the pre and post-op pictures in this patient, who's another patient, not the patient we're discussing today, where you can see that pre and post-operatively it looks the same. So breast conservation, as we know, it helps to improve the body image of a woman, helps instill confidence and improve psychosocial outcomes. The emphasis today is beyond just cancer cure, and we're moving towards improving the patient's quality of life. However, there are certain patients, we know Dr. Praveen has also mentioned to you that 50% of the patients who present to us today present in advanced or locally advanced stages. So there are those women who still require removal of the breast. Now, what do we do for such women where we cannot conserve? So in this case, we try to reconstruct the breast, or we do what is called conservative mastectomy. So conservative mastectomy is where we conserve the skin and the nipple of the breast. So it's either a skin sparing mastectomy or a nipple sparing mastectomy, and then we reconstruct it using implants or the patient's own body tissues. So this is the picture of a breast, and when I talk about a conservative mastectomy, what we have done today for our patient using the innovative and the novel endoscopic approach is where we retain the skin of the breast and we remove the glandular tissue, including the tumor. We try to save the skin and the nipple areolar complex. For patients where the nipple shows evidence of tumor, we have to excise the nipple as well. If the skin is involved, we remove the skin as well. But traditional minimal access breast surgery, nipple sparing mastectomy, if you see, you use incisions like this over the breast, right? So once it heals leaving behind a scar. And that is what we're trying to avoid. A breast is a very important organ for a woman, contributes to her confidence, her psychosocial scores as well. And that is where minimal access breast surgery comes into the picture. And when we talk about minimal access breast surgery, it is any approach or any instrument, any technology that helps you achieve this. It can be robotic, but in this case, we have introduced a very novel technique called the endoscopic approach. And why is it special? We will come to that in a minute. The advantages of endoscopic breast surgery is that the incisions are small, they're very well hidden. It has shorter post-operative recovery, offers excellent cosmesis, and preserves the body image of the patient. In patients with cancer, it helps us remove the cancer as well, and there's improved patient as well as surgeon satisfaction. The indications for endoscopic nipple sparing mastectomy are two. Either in patients without a cancer, right? But those who are at high risk for developing the cancer, be it because of genetic mutations or a very strong family history, they have to undergo what we call a prophylactic mastectomy. So in such women, we can utilize this technique. In patients with cancer, we can consider it in those with very early breast cancer, smaller tumors, and hopefully without skin involvement. Applicability and reproducibility in all hospitals in India without requiring large investments, and it assures the best and the latest advanced treatment for all our citizens. They don't really have to leave the country, go elsewhere to get the latest technology or the latest treatment now, and I think that is what makes it special. Moreover, I think, again, like I said, it's a matter of pride for us that we were able to bring this technique into the country, and this is the first time an endoscopic mastectomy has been performed in India. It has not been performed prior to this. The endoscopic, and I say endoscopic mastectomy here because that is what we have done for this patient, but by this means you can also do a breast conservation, you can address the axilla, etc. So I'm going to go into this description of the surgery. There are some images here. I'm just giving you all fair warning in case anyone's maybe disturbed by blood or vivid imagery.
Deliver the anchor speech.
Good afternoon, everybody. Namaste. Dr. Manjula Rao using a first for India, which is going to be a great boon to people who come forward when they take the battle on and step forward after diagnosis to make sure they get optimal treatment. Be it India's first endoscopic mastectomy with reconstruction or any other procedure. These would not be possible if they do not get the communication from the media on what they should be looking out for. And I would urge my friends in the media to give attention to what the lady said. Very few occasions women speak up against the disease. And if you look at the lady who seems to be from Tamil Nadu and spoken Tamil, she said that she noticed something and she actually went to get it rechecked and then was advised to get an early mammogram done. and then got in touch to discuss this with a family member. What's more important is to understand is there an echo treatment done at the Apollo Proton Cancer Center. But that awareness would have not been possible unless you would have heard what she said. That she watches television, she listens to what is being communicated, and she's aware what she should look out for herself. But there are very few people who are actually aware of this. And if you look at India, cancer is a great equalizer. We're so divided. There's one part of India where people are able to have a better 5 year disease free survival of cancer, and another location people have a very poor prognosis post cancer because of the inequality of care. So, in one extreme part of India, Arunachal Pradesh, people do not have access to basics of cancer care, where the survival rate is less than 50%.